Hello friends, I'm Dr. Neelam Makhijani. I'm pediatrician and neonatologist, owner of Care for Kids Clinic. I used to practice in Noida not too long ago. Currently, I'm practicing in United States. I'm honored to be a part of Panelist doctors associated with First Step school team. On behalf of First Step team, I would like to welcome all parents and friends for this brief discussion about kids ranging from 6 to 9 months old to 5 years old. Uh, in regard to the seasonal infections, especially this COVID infection in this era, and how to prevent them from getting sick. So, children are really precious, and if we see the data by CDC, COVID 19 disease really appears to be a milder in babies and young children. So, the reported cases that we have so far, according to CDC, only 1.7% of the cases are seen in kids, which are less than 18 years of age. So, you see, the kids, only when they're exposed to infection or they come in contact with sick people, can they get sick. So, how do we prevent them from getting sick? There are a couple of things we need to take care. Number one, and first and foremost, is let them be home. Do not take them out. Do not let them come in contact with sick people. Currently, we all are on quarantine, so there's no question of going out. But even after everything opens up, we cannot really say that this season will get over. So we need to keep kids home at least next 3 to 6 months. The 9 months olds are 6 to 9 month old are not really going to go out at all. They'll be anyway home unless any sick person comes in contact with them. So we need to make sure that we don't allow any sick contacts at home. The 2 to 5 year old preschooler kids are the one who are actually more susceptible than anybody else, as they can indulge frequently in a play date, or they at least want to go out to the park after everything opens up. So we need to make sure that we don't allow the social interactions at least for the next 3 to 6 months until everything clears up, to prevent our kids from getting sick. Now, the other things that we need to take into account is this infection can be serious, this infection can be mild, and since children have a very good immunity, they actually will not be suffering from the disease most of the times, but they can actually be a silent carrier, so they can transmit the infections to adults, which is a big hazard compared to the other things. So I would suggest keep them at home as much as you can, show them, tell them, actually you need to speak to them about this quarantine situation. Teach them the basic of cleanliness, like washing hands for 20 to 30 seconds, applying safe practices like sneezing in the tissue or on the elbow, and not coughing or sneezing in somebody's mouth. Also, we need to make sure that they have safe drinking water at home, because some other infections, which can comorbidly go with COVID, can also fulminate at this point. Now, given said that the COVID is not only the virus which is around, with these seasonal changes all over, we see that the weather is changing every day. Sometimes we have hailstorms, sometimes we have like rain, sometimes the temperature goes to 40 degrees, especially in Delhi. We need to make sure that we take care of other infections like the flu infections and the pneumonias. For them, they need to be vaccinated regularly every year. The only kids who are more susceptible in this COVID situation is the kids who have asthma or frequent bronchitis or allergies, or the diabetic kids. Also, there are some kids who are mentally or physically challenged. They are at high risk for this COVID infections. Now, how do you identify this COVID infection? This COVID infection, it comes as any other respiratory problem. So the kid can have breathing problems, they can have bluish lips, they can be very sleepy, lethargic, not able to get up, not able to eat or drink or keep anything down. Also, their day-to-day activities will be totally not normal. So that's the point when you really need to consider taking them to the doctor, or at least consult your doctor to take them to nearest emergency center if needed. Now, with all these things going around, the most and important aspect that we need to take care of is prevention. Prevention is the key, as with adults as well, but in kids, the prevention works more than anything else. So, the prevention will include the healthy diet, healthy habits, washing hands, giving them healthy food. Now, kids are very picky eaters, especially the preschoolers. They won't eat what you want them to eat. So we need to make a routine. So we need to be their role model. So we need to make food according to their taste, but we need to make sure that we follow a timetable, table manners. Like we all need to sit together to eat, and we all eat the same thing, and not just we'll be eating something really spicy and tasty, and we'll give our toddlers something else to eat, so they'll never eat. That's something we need to take into account. Along with all this healthy habits, healthy food, we need to make sure that the kids are supplemented. These days we have a lot of vitamin D deficiencies. Now, vitamin D is supposed to increase the risk of infections because it lowers your immunity. So we need to make sure our kids take multivitamins and calcium supplements along with their routine, activities, and they need to be doing some routine activities like physical exercise. If not going out, they can do some physical activity inside the house. That will really work. Now, besides these prevention, we do have some other recommendations that American Academy of Pediatrics tells us to take care while in this quarantine situation, which are very important. So we'll discuss that as well. American Academy of Pediatrics says that we need to make sure in this quarantine situation, since the stress is all over, we all adults are stressed out, so the kids will be stressed out as well. We need to make sure that we address that concerns. Now, kids can be, cranky. The kids are going to be just, clingy. So they will not express their anxiety in a way that we express. So we need to make sure that we reassure them. Simply reassurance is the key. So you simply reassure them that this is like any other viral infection, and this will also get over. You need to make sure that you are not going out, not meeting people. So we need to explain them in the language that they understand. So we need to tell them this is nothing to be panic of, this is something that we take precautions, like you don't have to run so that you don't fall. Same way, you don't have to go out to get any infection. So simple reassurance is what we need to tell them to, take care of. Give them the command, give them the control. Tell them, go wash your hands, and, tell them you need to wash. You count like 1 to 20 and keep washing your hands until 20 number finishes. You come back. Tell them to clean their nose or clean their utensils. Give them the control. You watch for all the anxiety signs, as I said earlier, like any clinginess, sleepiness, or not acting right, or crankiness. Address that. You need to monitor the media. The kids are all the time around you. So when you are watching news, the kids are also watching. Make sure they don't misinterpret the information that they're getting from the media, because they don't understand a whole lot. So you need to make sure that they understand what you want them to understand. So make sure the multimedia does not misguide. So make sure they are away from the TV as much as you can. Be a role model for them. You don't have to listen to news all the time. It's the same. Once in a day or twice in a day watching news is okay. But there's no need for the news to be on 24 hours a day. Nothing changes, every hour. So basically, these are all the key factors that we need to take into consideration when it comes to kids. We pediatricians always tell you to be safe, to do precautions, but as a mother, I would tell you it's really hard to keep them inside the house. So you need to engage them in some activities which help them, or you play with them inside the house so that at least they stay inside the house. Don't forget that their vaccinations is of prime importance. The yearly vaccinations are equally important. With the change of seasons and with all those flus and pneumonias around the world, we need to make sure that we give them vaccinations from time to time, especially 2 to 5 years is the time. 0 to 2 years we give them vaccination time, but the kids are lost when they turn 2, because then they don't have those monthly vaccinations. They have the yearly vaccinations. So we need to make sure we follow the same schedule of yearly vaccinations, whichever are essential to be given to kids. So make sure you follow all these steps. Medications to be only given when the doctor advises, and do not self-medicate your kids, please. Any concern rises, consult your pediatrician. Follow these steps. I hope you will take care of all these steps that I've told you. I'm available on the First Step side for any other questions. Please feel free to get in touch with me. You stay safe, stay healthy, and stay smiling. Okay? Bye until the next time.